Good morning. Thank you all for coming. I know that the last session went a bit over time. So we apologize to Professor Garden for our tardiness. It gives me great pleasure to introduce the Leslie H. Blumgart Historical Lecture speaker, Professor James Garden, an old and dear friend. James Garden is currently Professor Emeritus, Dean International, and formerly Regius Professor of Clinical Surgery, and head of the School of Clinical Sciences and Community Health at the University of Edinburgh. He trained in Glasgow, Edinburgh, and Paris. And after his training, he helped establish the HPB service there and the Scottish Liver Transplant Unit in Edinburgh. He established a world-renowned and first-class clinical and academic service. He and his group have led significant clinical, academic, and service developments in Edinburgh, nationally and internationally. And his group, the unit he established, continues to offer very high-quality surgical training in HPB and transplant. He has published extensively in this field and is the editor of 16 books, nearly 100 book chapters, and approximately 300 peer-reviewed articles. As director of Edinburgh Surgery Online, he established an innovative online master's surgery program in 2007 to support professional development and academic development of training of surgeons in training. And he now leads 8 master's programs, which have enrolled some 2,500 surgeons from 75 countries around the globe. The extensive scholarship program supports many surgeons in low and middle income countries, and the programs were awarded the Queen's Anniversary Prize for Higher and Further Education in 2014. He is formerly editor-in-chief of HPB, past chairman of the British Journal of Surgery Society, and a past IHPBA president. And I think it's fair to say that he was instrumental in saving the IHPBA from a very low period and dark time to make it what the society is today. He is vice president of the James IV Association of Surgeons and is an honorary member of several international associations. He holds many honorary fellowships with many surgical colleges. He was surgeon to the Queen in Scotland from 2004 to 2018 and was made a commander of the British Empire in 2014 for his services to academic surgery. So James, thank you so much for coming.
So, Bill, thank you so much for those kind words. I'd like just to take a moment to congratulate the Scientific Committee in putting together such a strong program. It's wonderful to be meeting in person in New York. It's been a challenging few years, and so it's good to meet friends again face-to-face at this Congress. I have perhaps some potential conflicts of interest to disclose, although I'm not actually quite sure how relevant they are to this lecture. Some of these have been shared in Bill's kind introduction. However, I feel that I have to make it clear that I have never worked with Les Blumgart, although our paths have crossed and I've been very conscious of his presence and shadow in the specialty throughout my career. I'd also just like to point out that I only entered medical school 50 years ago, so the 50-year legacy is clearly not mine, but I will use Dr. Blumgart's career as an opportunity to reflect on the major changes that have taken place in HPB surgical practice during this time, but to also try to better define the surgical legacy. There have been some distinguished individuals who've delivered this lecture, all of whom could be regarded as having left a legacy. I've also had the pleasure of listening to many of these lectures at the AHPBA meetings in the past and appreciate that a high standard has been set. I'm particularly honoured to be following Professor Henri Bismuth, who delivered this lecture last year. I spent a year training with him as a fellow in Paris in 1986-87, And I appreciate that I'm only here in this illustrious company this morning due to the rewarding period of training that I had with him. I know that some are actually frankly astonished to see my name against this lecture. I've always accepted that my name often comes into the frame through a series of administrative errors, but on this occasion it's clear that it is just because it's April Fool's Day. To me, Leslie Blumgart epitomizes legacy, the richness of his life, what he has accomplished, but also the impact that he's had on people and places. The AHPBA should be congratulated on having named a historical lecture after him. And I'm grateful for the fact that I'm being given free license as far as content is concerned. So I'll use the next 30 minutes to consider a remarkable career and use this to allow us to reflect on the extraordinary transformation of HPB surgery over the last 50 years, since he was first appointed to a chair in surgery at a time when our knowledge of liver surgery, particularly in the English-speaking literature, was limited. I also want to explore in more detail what is actually meant by surgical legacy. Now, I actually do think that I'm reasonably qualified to speak about history and legacy. I appreciate that Dr. Blumgart has not spent any time in Edinburgh at all, but there are connections which I will bring out. I'd like also to use the history behind Edinburgh surgery to make some points as to how we judge an individual's contribution to surgery and that legacy. After all, the Royal College of Surgeons, of which Dr. Blumgart is a fellow, has been around for over 500 years. Except the University of Edinburgh hasn't been around just quite so long, and our medical school was only established in 1726. But medicine has been taught in Edinburgh since the beginning of the 16th century, and the establishment of the medical school was dependent on the colleges of physicians and surgeons locally, and in its heyday, drawing some 1,000 new students at any time around in the 16th century. The founders of the medical school had been educated in Leiden and Padua. And I'm actually really pleased to be able to mention Padua because that was where I first contributed to an international meeting as a fellow when I was in Paris in 1987 and had stepped in at the last moment to give a number of talks on behalf of Professor Bismuth and was sharing the podium with Leslie Blumgart. He was very generous to me at that time, but I'll maybe talk a little bit more about that later. A number of medical graduates who came to Edinburgh either returned home and some went overseas and founded medical schools across the world, including the first medical school in the United States of America in Philadelphia. Now, given that my talk is going to come back to legacy, it should be recorded that Edinburgh was not noted for its policy of equity, diversity, and inclusion in the 18th century. In fact, unless your name was Monroe and you came from the same family, there was little chance of you being appointed to the chair of surgery/stroke anatomy. And intriguingly, John Monroe, who at that time was the president of the College of Surgeons, was a driving force behind the formation of the medical school. But he ensured that his son, Alexander Monroe, Primus, was appointed as the founding chair of anatomy. As you can see, 3 Alexander Monroes occupied the chair of anatomy continuously at university for 120 years. This was, however, a good example of how keeping it in the family was not necessarily a good idea, as the quality of anatomy teaching declined with each Monroe. It's actually kind of rather evident from just looking at Secundus and Tertius. And of course, that put the reputation of the University of Edinburgh at risk by the 19th century. But I'm pleased to report that Edinburgh has since addressed these issues of equity, diversity, and inclusion. But legacy is also about the next generation, and occasionally that involves export of talent. This might actually be a bit of a theme. One of Edinburgh's most controversial surgical exports to London was Robert Liston. He'd failed to secure a professorial appointment in Edinburgh, and unpopularity with colleagues led him to move to London, perhaps more than anything else just to seek his fortune. But there was no doubt that he was a skilled surgeon. In pre-anesthesia times, he was able to amputate a leg in less than 3 minutes. He was very skilled at it. It's worth just mentioning, this is good for the technologists amongst you, that this was facilitated by his holding his knife between his teeth during the amputation whilst he applied the ties to the bleeding vessels. It worked very well for him, apparently. But Liston is well known for the reporting of outcomes, and specifically in relation to 4 famous cases. The 4th famous case involved the removal in 4 minutes, you can see he was a real slick surgeon, of a 45-pound scrotal tumour, whose owner had to carry it around in a wheelbarrow or cart. I should just explain that that was before the operation, not after the operation. But his 3rd most famous case, again, just highlights the importance of team working. He got into an argument with his house surgeon or intern. The question was the red, pulsating tumour in a small boy's neck, a straightforward abscess of the skin, or a dangerous aneurysm of the carotid artery. Liston, of course, an impulsive individual, said, "Who ever heard of an aneurysm in one so young?" And so he flashed that knife out of his pocket, not from his teeth, lanced what he thought was the abscess, and the houseman records outleapt arterial blood, and the boy fell. The patient died. But the artery lives in University College Hospital Pathology Museum as specimen 1256. His 2nd most famous case, again, was kind of slightly unfortunate. He, again, an amputation, 2.5 minutes, slick as ever. But in his enthusiasm, he actually removed the patient's testicles as well. The patient survived, apparently. But his most famous case, however, underlines the importance of surgical record and audit. That operation, again, was an amputation of the leg, again, successful in 2.5 minutes, but the patient died afterwards. This was pre-Listerian times, so the patient died of hospital gangrene, or gangrene acquired, or infection acquired in hospital. Pre-anesthesia era, so the assistant actually had to hold down the patient. And unfortunately, Liston also amputated the fingers of the young surgeon, who then died afterwards in the ward from hospital gangrene, 2 deaths. He also, during the operation, slashed through the tailcoats of a distinguished surgical spectator who was actually so terrified that the knife had pierced his vitals, because he'd obviously heard about cases 2 and 4, he actually dropped dead in the operating room with fright. So this is actually the only operation in history that has a 300% mortality. Liston was nonetheless an innovator, and actually only 6 months behind Warren and Morton at Mass General in undertaking surgery in public under anaesthesia. I guess this was considered a major development as far as Liston was concerned, and probably had greatest impact on reducing his surgical morbidity and mortality. Just also want to mention one other person from Edinburgh, because I think legacy is also epitomised by Joseph Lister, one of Edinburgh's greatest surgeons, international reputation, but whose legacy expressed itself in many ways. His early surgical career, his early surgical training was in Edinburgh before he moved to Glasgow, like Professor Leslie Blumgart, where he developed his theory and practice of antiseptic surgery. He was perhaps at his most productive as an innovator and researcher in Edinburgh before he too moved to London to try to influence surgical practice there and spread the word about antiseptic surgery. Lister was valued as a teacher and served as a magnet for those surgeons who wished to progress their surgical specialty. He readily questioned dogma and as a result could be seen as intimidating, but was always fair and generous in his praise as well as loyal to his pupils. His legacy was therefore not just limited to antiseptic surgery and new surgical approaches, but he had just as great an impact as a result of those whom he trained and influenced at an undergraduate and postgraduate level. I said that legacy came in different ways, and an unexpected consequence of a rather long 3-hour oration by Lister at the Centennial Exposition in 1876 also had one Robert Wood Johnson in the audience. He rushed off after that lecture to have a chat with his brother and persuaded him that the two of them should combine to develop a pharmaceutical company which eventually became known as Johnson & Johnson. So Lister's got to take a bit of credit for that legacy as well. Now, in exploring Leslie Blumgart's legacy, I think we need to start at the beginning. Now, I'm not just quite sure when Dr. Blumgart decided that a career in liver surgery was on the cards or how he was going to get there. But you'll see at the top of the picture a young Blumgart looking resplendent in a kilt, playing the bagpipes. Not quite sure why that was why I'd been asked to give this oration because of that Scottish connection, but it was certainly a hint that Scotland was going to feature somewhere in his career. Some might not be aware of the fact that Leslie Blumgart started off as a dentist, graduating at Wits University before moving from South Africa to the United Kingdom to undertake his medical degree and then a postgraduate MD at the University of Sheffield. He clearly excelled and was recruited by Professor Patrick Forrest to the post of a clinical senior lecturer at the Welsh School of Medicine, where Les began to develop his HPB interests through endoscopy and in liver trauma and liver regeneration. He remained there until 1971, when he was appointed to the St Mungo Chair of Surgery at the University of Glasgow. This actually also coincided with his then boss, Patrick Forrest, leaving Cardiff to move to the Regis Chair of Surgery at the University of Edinburgh. Notable also because that was the very year that I entered medical school in Edinburgh, and also because I ended up undertaking my surgical internship with Pat Forrest on my graduation from university. In Glasgow, Dr. Blumgart was popular with his patients and staff. This was an exciting time, and he and his unit became a focus for surgical learning in Glasgow. This main image of him in the operating room at Glasgow Royal Infirmary is noteworthy, not just because of his being the obvious draw and centre of attention for the crowds of observers around the operating room, but actually also because at the head of the table, looking away, is Professor Donald Campbell, who remained as the Professor of Anaesthesia in Glasgow when David Carter, whose image is on the bottom right-hand corner, moved from Edinburgh to take up the St Mungo Chair in Glasgow. David had developed an interest in pancreatic surgery in Edinburgh, and he had become my mentor at an early stage in my medical career, and so I hung on to his coattails, being careful not to grab his vitals, when he moved to Glasgow and joined him as a surgical resident there. I might also just point out that Donald Campbell was the anaesthetist when I undertook my very first liver resection as a chief resident or senior registrar in 1987, when I returned from my fellowship training in liver surgery in Paris, but more of that later. Dr. Blumgart's time in Glasgow was prolific. Interestingly, he actually only, as far as I worked out, had 12 publications when he was appointed to his first chair. But over the course of 7 or 8 years, he added 129 publications to these. And these were significant in highlighting the challenges of practicing specialist liver surgery at a time when imaging was limited. Remember, CT scanning wasn't discovered until 1972, and full body scan by MRI was only first undertaken in 1977. Nonetheless, Dr. Blumgart made best use of what he could to develop that HPB specialist interest, highlighting, for example, the role of diagnostic ultrasonography in the investigation of jaundice, but also pioneering ERCP in the investigation of obstructive jaundice and pancreatico-biliary disease. He'd already declared a specialist interest in liver resection and published early results which highlighted improvements in past outcomes, albeit still with significant mortality and morbidity. It's notable that this publication still referred to the anatomical studies published in the English literature at the time. Now, rather like Liston and Lister before him, Dr. Blumgart moved on to London to take the chair of surgery at the Royal Postgraduate Medical School, Hammersmith in London, before a further move to Bern in 1986. But he now had momentum and had established a reputation in the HPB field that attracted many local and international disciples. Also, over this 12-year period, his publication record was immense, and he was in great demand as an international speaker. And I think that Les would also be the first to admit that this international exposure and networking allowed exchange of ideas for mutual benefit. His work at that time highlighted the increasing use of major liver resection in the management of colorectal metastasis, with improving morbidity and mortality rates that were now being observed in other centres. And again, this publication is notable for the emphasis on large liver resections. The focus for him and for many at that time remained the improvement or the improved selection of patients for surgery, as well as refining surgical techniques and indications for surgery. The influence of shared knowledge is also evident in this 1984 publication at the top of the page there, of the slide, which was on the management of bile duct strictures, with emphasis on the importance of Couineau's liver anatomy in their management. And this too is also highlighted in the other publication in relation to a novel subtotal hepatectomy with preservation of an inferior right hepatic vein. During this time, he also remained at the forefront of technological developments and innovation in both surgery and radiology. Now, actually, if I'm allowed to diverse a little bit, around this time and during my surgical and academic training with David Carter, I had the advantage of being able to benefit from a year's fellowship training in Paris with Henri Bismuth. When I went to Paris, few had much idea that the French had been undertaking complex and advanced liver surgery for a considerable period of time, with a tradition of liver resectional surgery well established by Lothar Jacob and Jean Hepp, who was Henri Bismuth's own mentor. And all of this was, of course, made possible because of the detailed knowledge of the segmental anatomy of the liver, which had been described previously in French, only in French, by Couineau in the 1950s. During my fellowship, I learned about modern techniques of liver surgery, much of which are still applied to this day at open and laparoscopic surgery. The use of intraoperative ultrasound for me was a revelation, the use of which in liver surgery had already been described by Mikuchi in Japan, had been embraced in Paris. And I became familiar with the French approaches to liver resection using Kelly Clazy and dissection techniques with the Cousa or Cavitron. I came to understand the principles of safe liver surgery, careful selection of patients, meticulous attention to detail in the operating room, and careful post-operative care. And I also benefited from being exposed to liver transplantation in a setting based in an HPB surgery unit. I benefited enormously from that experience as a fellow, and was also extremely fortunate to capitalize on my time there in being exposed to this vast experience, a lot of which had not been previously reported. And so as a trainee, I had the opportunity to present at international meetings and publish papers such as these two in the Annals of Surgery. The only two occasions in my life I've had two papers accepted without change by an editor of a journal. And these, of course, were actually based on the presentations that I had given in Padua alongside Dr. Blumgart. There were actually other important lessons to learn about legacy. Henri Bismuth was undoubtedly a driving force, and as you can see in the bottom right-hand image there, even the French president, when visiting his new liver unit, knew his place. And as you can see, Henri standing there surveying all. There were always challenging discussions at staff meetings, exchange of knowledge, networking, all of which created opportunity within the team. And I was fortunate to work at Viewsreef at the same time as a number of talented individuals who'd been drawn by that Bismuth legacy. Didier Samuel, an outstanding hepatologist, as well as gifted surgical chef and interns, including René Adam, who's here, I know, Daniel Charqui, Laurence Chiche, and Mario Marino on the bottom right-hand image there, who may be the only surgeon to have trained under both Les Blumgart in London and Henri Bismuth in Paris. Undoubtedly, the key event which elevated Les Blumgart's reputation to an even greater level was his move to the Memorial Sloan Kettering Centre here in New York. Memorial had already established itself as an excellent centre under the leadership of Murray Brennan. With Murray in the audience, I wouldn't say otherwise, but it was already delivering a world-leading surgical oncology service and fellowship programme. The recruitment of Dr. Blumgart by Murray Brennan to Memorial was clearly inspired and served as a catalyst for the growth of an outstanding HPB service and fellowship training programme. This was an exciting time for HPB surgery. Dr. Blumgart and his fellows immediately started documenting all interventions and outcomes. The groundwork was therefore established for another tranche of publications. It was also an interesting time as laparoscopic surgery was just coming to the fore. Indeed, I believe that this paper here was Dr. Blumgart's first publication to come out as a result of work at Memorial. Maybe not the most major publication, but one with a Brennan Blumgart protege as first author, Yuman Fong. Quality publications flowed, and it's noteworthy that documented operative morbidity and mortality rates declined and that the proportion of major resections had reduced with greater emphasis on liver preservation. There was an emerging focus on developing and sharing new techniques aimed at improving outcomes. An analysis of big data became increasingly important because of this rich documented resource. And this key publication demonstrated the benefit of that data collection and highlighted the Sloan Kettering focus in better assessing patient risk and selecting patients for intervention. The HPB group at Sloan Kettering team has set a high standard in having us all look at our own data and to challenge dogma to advance the practice of the specialty. Of course, for Leslie Blumgart, this was not just about the sharing of information through journal publication, visiting professorships and participation at national and international meetings, but through the publication of his major textbook, which rapidly became established as the Bible of HPB surgery. And this, of course, remains ever present and strong under the editorship of Bill Jarnigan, with the text encompassing much of the group's own work and that of its proteges. Collaboration, oh, wait a minute, have I gone? I'm just checking here. Yeah, so, collaboration has also been key, and the legacy has got to work globally. And to this, in this way, this kind of external validation, this particular publication undertaken in collaboration with Dutch colleagues, is important. And in this case, it's the validation of a prognostic nomogram for perihilar cholangiocarcinoma. Important to see whether these work on diverse patient populations. But such collaboration can also sometimes backfire. I'm actually delighted and pleased that I have my name against one of Leslie Blumgart's 650 publications, a study, admittedly, which was initiated by my colleague Rowan Parks and Newman Fong. But I think this is now the time to just publicly apologise now for the unforeseen circumstances of this publication. The paper is indeed very highly cited, but whereas this can clearly be seen to have had an astonishing impact on my own academic output and rescued a failing career with rising number of citations, it has not actually been quite so clear that this has been reciprocated as far as Dr. Blumgart is concerned. Admittedly, his output has always been at a higher level, the scales are slightly different, and I still have not caught up with his astonishing publication record. Nonetheless, this in no way detracts from the quality of the data that continues to emerge from Memorial over the last few decades, which in this publication again documents those improving outcomes for hepatic resection. I also thought that this was just an opportunity to mention one other legacy that might not be so well appreciated. Dr. Blumgart was a founding member of the International Biliary Association, in which the IHPBA has its origins. He served as its president in 1987 at an interesting time and involved my immediate mentor, David Carter, in discussions which brought about the merger of the IBA with the World Congress of Hepatopancreatical Biliary Surgery. Both served as IBA presidents before the inaugural IHPBA World Congress in Boston in 1994. Membership growth has been staggering. There were an initial 400 members of the IHPBA in 1994, and I think in yesterday's presidential address, we learned that the membership levels have now exceeded 4,000. And I think that the regional associations and the AHPBA in particular should be congratulated in the way that they have harnessed the collaboration with the IHPBA and should take a lot of credit for that. Part of Les Blumgart's legacy is the current HPB service at Memorial, which will continue to set a high standard as it adopts and delivers innovation. The new additions to the team will add considerable value. And clearly, again, Murray Brennan has to be congratulated on his inspired decision to recruit Dr. Blumgart 30 years ago. This is actually as much his legacy as Les's. The legacy of someone like Les Blumgart will not just rest with the surgical developments and innovation. It will largely be about the next generation, who undoubtedly excel and take HPB surgery towards all sorts of higher levels. Many of those former fellows are at this meeting, and it's quite extraordinary that both the AHPBA president and Bill Jarnigan as the IHPBA president-elect are products of that Blumgart legacy. Now, I indicated at the outset that I've never worked with Les Blumgart, but he has been an influence, somebody whose standards we in Edinburgh have tried to emulate. In the last 35 years at Edinburgh, the torch that he had lit, the start that he was given by Pat Forrest, has had a profound effect on the direction of academic surgery in Edinburgh, much in the way that I suspect has occurred globally. I know that the academic and clinical colleagues who have followed David Carter and myself will continue to aspire to these high standards. And we have tried our best to also emulate their exporting and nurturing of talent through our fellows. Now, it's evident to me that Leslie Blumgart's legacy is profound. The AHPBA should be congratulated on having named this lecture after him. I asked at the outset, how does his career experiences inform the next generation? What is the legacy? Well, I know that the IHPBA, as does the AHPBA, wish to nurture and support young talent. And I hope that I have convinced you that Many of you here are the legacy, irrespective of whether you have worked with Les Blumgart or not. We are all his disciples. Many of you are going to describe new techniques and new approaches, but you must retain a critical attitude to the safe management of HPB disease. When doing this, you need to be supportive of colleagues and fellows, even when they challenge you, and in this way you will produce your own legacy. Now, I know that Les Blumgart has not been well recently and was very disappointed that he could not be here in person today. And I doubt that I've really done justice in addressing his legacy, but I know that Bill Jarnigan, who visited him yesterday, here, as you can see, will be able to report back to him that he's been very much in our thoughts and has now participated. I thank you for the invitation. It's been a privilege to deliver this 10th Leslie H. Blumgart Historical Lecture. Thank you.
James, that was a very stirring set of remarks, and we're grateful that you were able to come and deliver them. And I did see Dr. Blumgart, the professor, as we call him, yesterday, and he sends warm regards to all, and he's thinking of you, and he's sorry he couldn't be here. But on behalf of the IHPBA and the AHPBA, please accept this small token of gratitude for coming and sharing this with us.
Thank you very much.